So everyone, today I'm going to discuss about spinal cord tumors. Generally, spinal cord tumors are less common than brain tumors, but if we take into account that the mass of the spinal cord is 6 times less than the mass of the brain, then we can assume that both parts of the central nervous system are equally prone to tumor growth. As you see in the picture, spinal tumors develop in any age, but it's extremely rare before 10 and after 60 years. So as you see in this picture, like this tumor is between the disc and the vertebra and between the spinal cord. About the classification, spinal cord tumors can be primary and secondary. So the primary ones come from the tissue of the spinal cord, its roots and membrane. About the secondary one are metastatic. In the clinic, it is customary to divide spinal cord tumors into intramedullary, which develop from the substance of the brain itself and are located inside the spinal cord. So, and extramedullary, which are formed from the membrane root located outside the spinal cord, and we have extramedullary tumors, depending on their relationship to the dura mater, are divided into subdural and epidural. So extramedullary tumors are much more common than intramedullary tumors. Among the primary tumors of the spinal cord, the most common are neuromas, arachnoid and endothelius and gliomas. Neuromas original from the cells of the Schwann membrane of the spinal roots. They are well demarcated from the surrounding tissues and are easily accessible for radical removal. Arachnoid endotheliums are formed from the endothelium of the arachnoid membrane. So, like neuromas, they are benign gliomas make up the bulk of extramedullary tumors. In the vast majority of cases, they are not available for deletion. About the pathogenesis, the mechanism of development of symptoms in the spinal cord tumors is closely related to the location of the tumor. Symptoms depend on the level of localization of the tumor, like cervical, thoracic, other parts of the spinal cord. On the relation of the tumor to the substance of the spinal cord, you have intra and extra tumor. On which surface of the spinal cord, like lateral, posterior, or anterior, the tumor is adjacent to on the relationship of the tumor to the membrane of the and whether the tumor is benign or malignant. Spinal tumors have direct mechanical effects on the spinal cord and spinal roots, compressing them as pressure is applied to the spinal cord. The clinical picture of spinal cord tumor depends on many factors. However, there are symptoms common to all spinal tumors. So, both extramedullary and intermedullary tumors are characterized by slow, steady increase in the pattern of compression of the spinal cord. And since if the tumor squeezes the vessels feeding spinal cord, the level of conduction disorders depends on the location of the tumor. That's all, like generally. Focal symptoms. Spinal cord tumors are caused by tumor damage to the spinal roots and spinal cord segment at the level of its location. When the tumor is located in the upper cervical segments, it can be spastic tetraplegia is observed, like sometimes in combination with flaccid paresis of the neck muscles. So the pain is localized in the neck, shoulder, girdle, collarbone. Sensitivity disorders begin from the appropriate level. With the tumors in the region of the cervical and first thoracic vertebral segments, flaccid paralysis of the arms and spastic paralysis of the legs develop. So the localization of pain and the level of conduction disorders of sensitivity depends on the location of the tumor. There may be Barnard-Horner syndrome disorders of the function. The pelvic organs with tumor of the cervical spine are absent for long term. but when they appear, they are in the nature of periodic urinary incontinence or urgency. And we have tumors of the thoracic region are characterized by girdle pain, contraction disorders of spastic paralysis of the lower extremities, and central urinary disorders. And with tumors of the sacral segment, pain is localized in the foot along the back of the high and ungenital region. So the function of the pelvic organs suffer early and severely through incontinence or retention of urine and feces. So caudal tumors are characterized by severe pain in the lower extremities and in the vulva. Reflexes are lost relatively early sensory disorders, and paralysis appear late. Pressure ulcers and urinary retention are common. About treatment, the only effective treatment for spinal cord tumor is surgery. Being tumors are subject to surgical treatment, conservative treatment, and we have conservative treatment, which is a stationary regimen, least restorative and an analgesic agent. And so surgical treatment of tumors gives favorable results. Most patients recover from work capacity. The prognosis of surgical interventions is largely determined by timely and correct diagnosis. In malignant tumors, an attempt is also made to radically remove the tumor, followed by X-ray therapy. X-ray therapy can be delay tumor growth and reduce the number of neuropathological symptoms. And indication for its use is also pain that is not amenable to drug treatment. So this is my